There are no incurable diseases, only a lack of will. There are no worthless herbs, only a lack of knowledge. Okay, welcome back, guys. I'm making this video today to show you all that I do actually have some tumors, that I've gone to a doctor, I've got the tests done, I've got the contrast CT scan done for the adrenal adenoma, adrenal tumor, and I've got an MRI, a contrast MRI done to find the pituitary tumor, the Prolactinoma, yeah, I believe it's called. So I'm going to show you guys those test results, and I'm going to also show you guys some blood tests that I've done for hormones, for just general blood count, things to do with my immunity, my vitamin D levels, and I'll also show you guys the actual picture of one of my tumors. The radiologist was nice enough to allow me to go in there with him and take a picture so I could show you guys. Well, he kind of owed me one because he made a mistake on saying that everything was okay the first time. I got my CT scan done. The report said everything was okay, so I had to trust my intuition and get a second opinion. So then I finally, after a month and a half later, realized that I have the adrenal tumor. So I'm glad that he apologized and he's willing to be a friendly doctor. So the results were in the local language, Armenian. I used Google Translate to translate it for you guys, and just mostly gonna just zoom in and focus on the things that are out of range and out of balance. The results for the contrast CT scan and a lot of the tests I did are from Yerevan Hospital in Yerevan, Armenia, and Erebuni Hospital. There's also some tests that I've done from what they call here a polyclinica. It's like your regular kind of family doctor. First things first, I'll show you guys the report from the radiologist from the contrast CT scan. The contrast CT scan was done on most of my body, like neck down. I was originally checking for abscesses. That was my point in doing this, but they found the tumors. It says here, highlighted in yellow, it says a spherical nodular mass with partially clear edges is visualized in the lateral stipule of the left adrenal gland, which has a disproportionate mass on the axial section, measuring 3.2 m, which I'm assuming is millimeters. It's usually supposed to be mm, but I guess it's just m, which has a disproportionate mass with a density of 44-75 HU. Not exactly sure what that means, but it says later on it goes to say that the right adrenal gland is fine, the kidneys are in normal position. It seems to be everything else is pretty normal. And down in the conclusions, it says a nodular formation of the left adrenal gland, radiologically typical of an adenoma. But in order to clearly identify and differentiate it from a phocytoma, an endocrinologist consultation, histological verification, and dynamic control are desirable. So I went and I saw my endocrinologist, and we did some other tests, and I talked to her, and she seems certain that it is adrenal adenoma. And then we went on to do some blood tests, and also an MRI of a contrast MRI of my brain to check for pituitary tumor. So like I said, I got this contrast CT scan, it came back, everything was normal, and I just couldn't believe it. I went after a month and a half of thinking, oh, maybe I am crazy or I have some kind of a psychosomatic problem, maybe I'm just imagining these symptoms, I finally got the test checked by another doctor, and then the results came back. You have a tumor. And at first I was really happy, that I finally figured out what's wrong. And then later on that night and the next few nights, I got those typical headaches that I get when I'm not on this diet. And it was pretty frightening to think that, this is because of a tumor. But after a few days, I got over it. I was thinking, I've had these symptoms for so long. It's not going to kill me, or it's not going to kill me right away. I have time to do something about it. And I have a good degree of confidence on healing tumors in general. Call me crazy, but I've done my own research for a long time. I feel like there's a natural approach, and have a lot of kind of built up confidence from talking to people that have had tumors and doing some research on certain types of ways to heal tumors. So I quickly first got really kind of happy I discovered it, and then kind of freaked out by these tumors are causing these headaches. I can actually feel in my body the effects of a tumor, an unnatural growth. And then I got into gear and just made a plan of what to do and put it into practice. This is a picture of the CT scan of my body, and if you zoom in here, you can kind of see where the doctor put the little arrow. That round thing, that's the adrenal tumor. And this is another picture of it, kind of zoomed in. I think the CT scan kind of takes pictures of different slices of your body. So this is another slice from another angle. Again, it's that big round thing with the arrow pointing to it. So the radiologist told me to go and talk to an endocrinologist in the hospital, and she told me to do some hormone tests and do a contrast MRI of the brain. And this is the result from the contrast MRI. It says here a small focal structure with contrast delay in the left half of the adenohypophysis, measuring 2 times 1.5 millimeter, I'm guessing it is. It says that the pituitary gland is located in a normal spot, and Turkish saddle is stable. Other things seem to be okay. My brain tissue doesn't have any pathological changes, so that's good. The main thing here is MO image of pituitary microadenoma. So it's a small pituitary tumor. These are the hormone tests I did. She sent me to the other hospital to have a consultation with another doctor over there. It was a surgeon, and I did some tests there, some tests in the Yerevan hospital. It shows ACTH is normal, TSH, cortisol. The other hormones that they were concerned about are normal. Prolactin is high. So that is supposed to differentiate my tumor as a prolactinoma. My prolactin levels are twice as high as the upper end of the range. So my endocrinologist said the way that we cure these things or treat these things is to give you a drug. I believe the drug's name was Dosinex, but there's a few different kinds. It basically kind of makes imitation or artificial type of dopamine in your brain to lower prolactin. So it seems that prolactin and dopamine have a relationship with each other. When dopamine's high, prolactin goes down. And she said that it kind of works like 80% of the time. Either she kind of said that, and I also researched it. seems to work most of the time, and when it works, it shrinks the tumor, and rarely it completely eliminates the tumor without any surgery or anything. But oftentimes it just shrinks it so it's surgically it can be operated on easier. I noticed that from my own research that there are some side effects with this, and for I think like 20% of the people, the side effects are too much for them, that they just drop the medication. I don't like the idea of kind of taking drugs, hormonal drugs, drugs in general, but especially ones with medium to high level of side effects. Some, especially drugs that affect my psychology. I don't want to take those kind of drugs personally. I want to make sure I'm myself. And they also said you should take some antidepressants, but I also said no to that. I have a bit of a mistrust of these things. So personally, me, not into that kind of stuff. And I just decided to kind of think about it myself for a little while, and that's where I got into the ideas that I've been mentioning about my plan, doing things that naturally raise dopamine and staying away from the things that increase prolactin. These are some blood tests I did. So this blood test, there's the total number of leukocytes, which is means that your body's fighting something. It's your white blood cells. When it's high, that means maybe you have either acute or chronic infection, either it's bacteria or it's viruses or parasites. I've seen that in other tests I've done before, so that's part of my suspicion that I might have some kind of a chronic infection. That's the whole reason I did this contrast CT scan. There's that, and also an oral bacteria test I'll show you guys soon. The total platelet count was a little bit low. That is to do with your blood's ability to clot. The doctor said it's not that big of a deal, and I think I've seen it a little bit out of range before. So I'm not paying too much attention to that. Who knows why it's a little bit low, but it seems to be not that much of a concern. Absolute number of monocytes, that is also a version of a white blood cell, if I know my stuff here. The doctor said it's not too big of a deal, it's not too high, but I'm suspicious. In the past, the one underneath it, eosinophils, that's also been out of range. I have a feeling my body's fighting something for years. I don't know what, I'm not sure, it's just a feeling, but these have been a little bit out of range for years. Here and there when I do blood tests, I've seen them out of range. So, the doctors say it's not too big of a deal, but I'm a little bit concerned about it. In any case, this last test I did, those are the things that are out of range. This other test I did with my family doctor here in Armenia, the average volume of hemoglobin in an erythrocyte. I'm pretty sure that's just the oxygen that's in the blood, and the doctor said it's not a big deal. It might be because it's higher altitude here. It might be because you're a smoker. It's not too much out of range. Don't worry about it. All these things, he said, it's not really much of a big deal. It's just slightly out of range. So the important thing is that thrombocrit is good. I think that has to do with whether you're kind of at risk of having a stroke or a heart attack. In this one, the monocytes and the neutrophils, the white blood cell count is in normal range, so that's a good sign. This test was done October 5th. I discovered my tumor in mid-December, I believe, so it's just like a month before that. This test is my vitamin D test. I am deficient. It's the range is 31 to 70. I have 25.4. So, ideally, I want to have like double that. I'm not too sure. Some people say there is no such thing as vitamin D toxicity, but definitely I don't want to be deficient. I am going to do my best to get vitamin D naturally through my food. The diet that I'm on is basically Dr. Sophia Clements's paleo-ketogenic diet. She says that most people don't need vitamin D supplements, but the only supplement that she ever gives her patients is sometimes vitamin D. So I'm going to try it out. After eating this diet for a month or two, I'm going to go do another vitamin D test. And if I'm still out of range, if I'm still deficient, then I'll start taking vitamin D, probably like 4,000 IUs, because I've had experience with 4,000 IUs putting me into a normal range in the past. I might just start off with 10,000 IUs a day just to kind of boost me up, and then after I'm in a normal range, I'll go down to 4,000 IUs. And this is my oral bacterial exam. So I went to the dentist, a special dentist that has experience with oral bacterial infections, and I asked him to do a bacterial exam in my mouth. He told me, come in tomorrow morning, don't brush in the morning, don't smoke, don't drink anything, don't eat anything, just brush the night before. And that's what I did. It came out positive for Staphylococcus aureus. And Staphylococcus aureus is a type of staph that is anaerobic. It can survive in an oxygen-deprived environment. It is potentially very dangerous. It's something that Staphylococcus aureus is considered MRSA, so it's kind of like antibiotic-resistant bacteria. I have experience with this and strep from having tooth infections in the past. So I know that this is a potential indicator of an infection in the mouth, maybe in the sinuses, maybe somewhere else in the body. It generally is found in abscesses. So this is like, when I got this result, at first the doctor was like, oh, we got to get you on antibiotics, we got to get this out. This is potentially very dangerous and life-threatening. And we also did a scan of the mouth, like as far as the jawbone goes, and we did x-rays. Didn't find any infection in the mouth. The dentist kind of had like a varying degree of responses. At first he said, it's really serious, we got to get this out, and I kind of agreed with him, because I've been feeling that I've had some kind of a chronic dental infection for a while, or mouth infection, some kind of a body infection, but I just don't know where it's coming from. So I agreed that we got to get rid of this infection. But then later he said, oh, it's not too big of a deal, it's kind of a normal thing in your mouth. And I did my own research, and it's not really a normal thing. I think, if I remember correctly, it's like around 50% of people have this in their mouth, but it's not normal to have it in your mouth. Maybe those 50% of people are people that have some kind of an illness. I'm not sure. I know that with a lot of infections like this, it seems to be that when someone's ill, that these bacteria and funguses kind of multiply and go into kind of levels that are considered infections. So, after he kind of changed his mood on this back and forth a few times, at the end he told me, you don't have a mouth infection, that's clear. You should check, maybe it's coming from another part of your body. So that's when I went and I did the contrast CT scan. I just thought to myself, how am I going to find it? If it's an abscess in some other part of the body, I need to do a contrast CT scan. I went to a hospital. I just kind of picked a specialist that would be able to order such a scan. So I just went to a gastroenterologist and asked her, I told her what the dentist said, and I said, I just want to rule out having an abscess somewhere else in my body. So she ordered a contrast CT scan of like the rest of my body, like neck down. And that's how I figured out I had these tumors, I have these tumors. I did also take the antibiotics. It's shown here that there are a few antibiotics that Staphylococcus aureus can be sensitive to. I've taken amoxicillin within the last like 6 months or a year, so I'm pretty sure I took something else, maybe levofloxacin. I can't exactly remember, but I took some antibiotic I took the whole course, and I didn't really feel much of a difference. I want to get this oral exam done one more time to see if the levels are still high, but right now I'm kind of focused on this tumor thing for now. But it's very interesting how you kind of find stuff like this in a non-direct way. I'm glad that I kind of did this test, which is an unusual test, and it led me to finding these tumors. Yeah, so that's it for today's video. I am going to do some more blood tests in about like a few months after doing my plan of attack, my plan of healing, and hopefully we'll see some positive results. Mainly I want to get prolactin down into normal ranges. The doctor said if it gets back into normal ranges, there's a chance your tumor will shrink and disappear. So that's my main goal, and hopefully I want to see everything in normal ranges. So I'll definitely make a video on that, and I'll keep you guys posted on how I'm feeling and how I'm doing in general. Thanks for watching.